patients with severe pain, cachexia, anorexia, weight loss, and or severe nausea from cancer, HIV/AIDS infection, severe pain following severe forms of arthritis, epileptic seizures, and under conditions where patients are expected to be dying within the next 3 to 6 months as a compassionate end-of-life care treatment. Category 2 essentially contains everything else that a physician may feel is appropriate. This includes fibromyalgia, chronic neuropathic pain, and other disorders. The difference between Category 1 and Category 2 from the perspective of the regulations is that for a patient to receive authorization under Category 1, the physician may be a family doctor or a specialist who is treating the condition. For Category 2, the case must be discussed with a specialist before the approval will be given. You will note that under Category 1, the emphasis is on severe forms of disease. This is not a treatment that doctors in Canada will give for mild low back pain, for mild headaches. This is for severely ill patients. Here's an example of the website at Health Canada, which gives information on the Health Canada supply of marijuana, how the application forms, some issues about the law and law enforcement, as well as statistics around cannabis use. Once the regulations were put into place, there was a question about where the cannabis was coming from. Cannabis was contracted, a company was contracted by Health Canada to grow cannabis for its access program from a company called Prairie Plant Systems. Cannabis is grown in controlled environments where the light, humidity, temperature, and other parameters are carefully controlled. The knowledge of exactly what goes into the soil and into the plant are carefully controlled and standardized. And the product is tested when it's produced for the presence of any impurities or toxins. It is sent to the patients in gold foil bags. It looks like coffee. And it has about 12% THC. It costs $5 a gram, and the average dose that patients in the Health Canada program use of cannabis per day is 2 grams of cannabis. 2 grams of cannabis per day is about 4 small cannabis cigarettes per day. This is the average dose that the patients use. Initially, the cannabis was criticized as being too dry, as not having a very good taste, and the patients did not like it. So we conducted a study using different types of cannabis, varying the humidity and dryness to show that to Health Canada that this was something the patients could determine. And we found, in fact, that the patients preferred the product with the highest THC level, with the most humidity, and with a large grind size. The product is prepared by grinding it into a powder. And having issued the cannabis with this improved quality or improved specifications, the number of patients using it was increased. This graph shows you the number of patients in Canada who have participated in the Health Canada program over the last 8 years. From September 2002, when the statistics were first calculated, there were under 500 authorizations. As of today, there are over 5,000 patients authorized to use cannabis in Canada. The majority of these patients have a personal production license, which means that they can grow their cannabis for themselves. Another proportion are designating somebody else to grow it for them, and about 20 to 25% of the patients receive cannabis directly from Health Canada. These issues around production and cultivation of cannabis by the patients themselves has given rise to very great difficulties with law enforcement in Canada, as there have been entrepreneurs who are buying licenses from patients and setting up businesses and selling the drug for recreational purposes. This kind of abuse of the system gives a very bad name to medical marijuana, and it does no justice to the severely ill patients who are using it. Under category 1, this is a distribution of the kinds of patients using it. About 1/3 have severe forms of arthritis. About 15% have spinal cord injury, 15% HIV/AIDS, and 15% multiple sclerosis. The rest have a range of other conditions. One of the major issues around this program was that there was no attempt to educate physicians on what marijuana is and how it is to be used. I point out to you that under the regulations in Canada, cannabis is not a prescription. It is an authorization by the government for the patient to be in possession of the drug. Remember that it is illegal otherwise. But the physician cannot prescribe it because it hasn't been approved by the regulatory authorities that approve prescription medications. So when we talk about cannabis use in Canada, we talk about authorizations, not prescriptions. But to make this clear to physicians who still feel that they can prescribe cannabis or who are concerned about prescribing cannabis, we set up a program to educate physicians across Canada. This is a map of Canada from Vancouver, Calgary, Edmonton, and parts of the Prairie provinces, Toronto, Montreal, where I'm from, and the eastern provinces of Nova Scotia and Newfoundland. We have conducted seminars across the country, reaching over 1,000 physicians in the last year, teaching them about what cannabinoids are and how they work. I think you've had in the last day an extremely important overview of how cannabinoids work, and it's very similar to the information that we give physicians. But I would like to ask this question. How many physicians, how many medical doctors are in the room today? Please raise your hand if you're a medical doctor. So I'm counting about 10 people in a room. Thank you very much. I think we need, if cannabis is ever going to evolve into a medication with wider approval or understanding, we need to be speaking to physicians. We need to be speaking to the medical doctors who are the ones who have to treat the patients and the ones who have to understand. Cannabinoids are not taught in medical schools. Cannabinoids are not taught in education programs classically around Canada. So we have had to make an effort to reach these doctors, and they're very, very interested. This is the range of specialties that are coming to these sessions. About 40% are from family medicine, but about 7% in 2009 were from psychiatry. This has increased this year to 20%. The number of psychiatrists coming to us to talk to us about cannabinoids in their populations is increasing. And the reasons why include some very important findings that they're telling us, that patients are using cannabis as a way to stop using other drugs like alcohol and injecting heroin. They're using it as a treatment to help them come off these drugs. The patients are using it. And the physicians are looking for information on whether this could have any physiological meaning and how they could use this in their practices. They're also seeing use for post-traumatic stress disorder in patients and soldiers coming back from fighting wars in the Gulf and in Afghanistan. And they're coming asking if there's any information. I think it's very important to talk to physicians, because if they hear these stories from patients, as we did, it gives us a very strong impetus or very strong rationale for conducting further studies in some of these areas.